Good afternoon and welcome to the 2018 launch of the Brown Bag Webinar Series. This is a webinar series featuring Virginia Hospital strategies to promote patient safety culture and high reliability. My name is Joan Williamson. I'm Director of the Virginia PSO, and on behalf of the Center for Healthcare Excellence and the Virginia Hospital and Healthcare Association and the Virginia PSO, I'd like to welcome you to this continuing series of brown bag webinars promoting positive safety culture and high reliability. Today's presentation is updating our leader HRO Toolkit presented by Sentara Healthcare. Our presenters today are Dr. Joel Bundy, VPMA for Sentara Lee Hospital and Executive Medical Director for Sentara Patient Safety for Sentara Healthcare, Sarah Darwin, System Director, Patient Safety and Performance Excellence, and Kathy McCoy, System Director, Patient Safety and Performance Excellence. I wanted to go over just a couple housekeeping items with you and then I'll turn it over to our Sentara team. Slides were sent out this morning to those of you that were registered. If you registered late, you can access the slides in the handout section of the GoToWebinar platform. This webinar is being recorded so it can be shared with others who are unable to attend. We do ask that you please dial in using the telephone option if you are able. You will be prompted to enter your audio PIN. This will allow us to have a discussion at the conclusion of the webinar. At this time, all participants are muted and all panelists are unmuted. If you have a question, we ask that you hold that question until the end of the webinar. You may ask a question by simply typing your question into the question box located on the tab menu. And with that, I'm going to turn it over to our Sentara team. Dr. Bundy.
Good morning, everybody. Happy Monday, and it's a great time for us to be here with you. So I'm Joel Bundy. I'm a recovering nephrologist from this area and now work with Sarah and Kathy. And I'm really, really excited to be here today. And the three of us are going to try to share who we are and why we've started this journey again and what sort of lessons we've learned. So who we are. Sentara Healthcare, we've been around for a long time, 128 years. We have 12 hospitals, 2,700 beds, 12 long-term care facilities, a health plan, and 27,000 plus members of the team. We are, in Virginia, the 5th largest employer in the state. We've had a safety program that's gone back, next slide, Kathy. For a long time, since around 2003. And this is something that we've all learned over the years. And it was a grassroots effort to try to come up with these things, but we thought it was very encompassing for when we're busy, making sure that we understand things, pay attention to detail, communicating clearly, having a questioning attitude, handing off effectively, and never leave your wingman, which we came up with because we're here in Norfolk, Virginia with the Navy and all the tools that go with that. And we've been on that journey for about 15 years. Next slide. And as you can see that we have had some shortcomings. We've had people that we've harmed, and we take every one of these very seriously. So how do we decrease the numbers of serious safety events in our system? How do we learn from these issues? And how do we go from having these events to having more dynamic non-events where people don't get harmed, but we can learn from those things? Next slide. So like Simon Sinek would say, start with why. And that's what we're going to try to do today. We're going to talk about the why, and then through the rest of the talk, we're going to talk about the how and then the what. And obviously, like with most organizations, whether it be on the sharp end or on the blunt end, there's churn. There are changes in leadership, and people come and people go, not just with the executives and other leaders, but with physicians and the staff. And so in an attempt to try to improve our clinical performance improvement initiatives, we felt we needed to sort of go back to the beginning We were seeing an increase in wrong events, more CLABSIs and CAUDIs than we had expected to see, an increase in our serious safety event rate, and more falls. And in addition to this, there were other things that we were seeing, such as customer satisfaction and not making those goals. So what could we do? Since in 2008, we had actually started this journey on a high reliability, and we had rounding to influence, daily huddles and action plans, but obviously we were not sustaining that. So what could we do? As we brought on new hospitals, we saw that those new hospitals, we had to inculcate those principles that we had learned from an HRO standpoint and our safety program standpoint with them. And over time, we realized that we really needed to have a refresh. Next slide. So
this is Kathy. I'm going to take us through what we did in 2016. So we engaged HPI Press Ganey to start out with an assessment to get an idea of our current use of our leadership tools. From that, then we revised our HRO leader tools based on the assessment and high reliability concepts. Additionally, we spoke with other HPI clients to hear about their HRO journey. Along with HPI, we pulled together a group of 12 senior leaders from across the company, and that included the chief nursing executive, the chief medical officer, our COO, our VP for organizational learning, some divisional executives, and pulled them into an executive design session to talk about the leader tools and what should our new leader tool look like. And it was really a conscious decision on our part to begin at the senior level leadership and train them first before we move these concepts down to the rest of the organization. When we began our safety journey back in the early 2000s, we did that backwards. We started with the staff and then worked our way up. So this time we decided, let's start at the top and work our way down. And then what we did is we held 3.5 to 4 hour sessions, and every executive had to attend one of those sessions. So this is what our revised toolkit looked like. So again, the 3 categories, we focused on a message on the mission, safe operations, and then building accountability. The new tools to our toolbox included safety first, and what that means is before you would make any decision, you stop and think, how will this affect the safety of our patients and staff if we make this change? And then rounding to influence became more intentional on how the leader interacts with the staff on a specific topic. For instance, if they want to talk about catheter-associated UTI prevention, they would use that as a topic when rounding with staff on that day, talking about what are the expectations for the staff, asking for their commitment, and then any barriers that they could have to performing as expected. For safe operations, we added daily huddles integrating the learning board. So we've had the daily huddles for quite some time, but it was really integrating those learning boards that was new for us. And we'll go over those in the next couple of slides. And then the other new tool we added for leaders was the situation behavior impact feedback model. And this came from the Center for Creative Leadership. And the book is titled Feedback That Works: How to Build and Deliver Your Message. The author is Sloan Weitzel, W-E-I-T-Z-E-L. It's a very quick read. I think it's like 45 pages long. But with that, you're describing the employee situation that you were in when you observed this behavior. For the behavior, you're observing what that was that you observed. And then for the impact, how did that behavior affect whatever was going on at that time? So a little different from what we had for feedback in the past for staff. So for our employees and for I guess normal interactions with the staff, you would still use 5-to-1 feedback for the positive to constructive feedback, but the situation behavior impact model was when you wanted to offer really specific constructive feedback or constructive feedback to the staff member. And then the red rules and the just accountability were also in our previous toolkit. So what we saw following our senior leader training, the divisions became much more consistent with starting each meeting that had an agenda with a safety message. So if it was an impromptu meeting, it did not have an agenda, they would not have to have a safety message. But what we found that even those meetings are tending to start with a safety message. Our daily huddles at the facility level had a renewed emphasis with improved content and incorporating the use of the learning board. And this is just two examples of learning boards from two of the facilities in our division. So some will typically have a list of the units to report out, the agenda of what's going to be discussed during huddle so it stays very focused. The red, yellow, and green sections were new to us. The red being any new item that is a threat to safety. During that huddle, then it would move to the in progress. If it couldn't be solved right away, if it's low-hanging fruit and you can solve it, you would do so at that time. If not, it would stay on the in progress note. On these forms is a place to assign that issue to with a date for follow-up. Once those items are completed, you believe that that issue is resolved, it would then move to the completed section. But even in the completed section, we wouldn't get rid of those forms. We would want to hold on to those in case that issue resurfaced so we could pull that out, see what was done the previous time to fix that solution, because obviously we would need to do something different then. And this is what the template looks like at Sentara for our learning boards that we rolled down to the staff then. And we told them this board could look different in each unit as long as it had these components on it. So we wanted to make sure they kept that red, yellow, and green sections for their items that their staff were bringing to them. For the metrics, that's really focusing on those one or two top metrics that that unit really has to pay close attention to. And then what was really new for us is we added this acknowledgement section where staff could acknowledge their coworkers. You could post congratulatory comments from, or thank you comments from the staff or their significant others. But it's a nice way to give those that recognition to other staff members.
Okay, so this is Sarah, so I'm going to take over from Kathy here. So, this was a multi-year journey for us. So, we spent 2016, as Kathy already said, focused on the senior executives in our company. So in 2017, it was really time to move the training down to that next layer of leaders, which is about 1,600 leaders across our company. So that's really team coordinators, managers, directors, all those folks. So we really worked with HPI on developing the training for those leaders. And one of the things that we had learned from our training to our executives is that the feedback from the training sessions was very positive. But one of the challenges to us was really making that training relevant to leaders in any division, whether it was a clinical or a non-clinical leader. So we have, leaders in our managed care division, and our finance, HR, IT, all those divisions, and that we really need to work harder on making that training more relevant for them. So work with HPI on that. We actually had a pre-session that we pulled representatives from those non-clinical areas into. They helped us get stories and vignettes that were really appropriate for those non-clinical areas so that we could really infuse that through our training. So at the end of the day, we ended up with 40 sessions that we expected team coordinators, managers, and directors to attend. We were real fortunate in that we were able to have HPI consultants actually lead those sessions because, clearly they're the experts, they're great content experts on that material. We ended up doing 1,354 leaders through those 40 sessions. We actually, 655 folks completed a post-session survey, and we got great ratings. We got 84% ratings, either very good or excellent. So we felt good about, the training that we delivered, those 3.5-hour sessions. The other thing that we did with those sessions is we tried as much as we could that when a session was at a particular division, is we got those executives from that division to really kick off that session. session so that the leaders could really see, that it was important content and that, that they needed to be there and listen to the training. So what else did we do? So we've taken that integrated reliability training, those sessions now, we've built that into our onboarding for new leaders. So all new leaders get that same 3.5-hour training. And then one of the things we did for sustainment, we hope, is we built in HRO champions. And so the HRO champions is we ask the presidents at all those divisions to select one person. Some actually selected more than one. Those champions got additional education. They attended extra sessions. And then we held a special session for them with HPI so we could really talk about the tools in detail and really give them some tips for how do you assess those tools and make sure that they could be really viewed in their divisions as kind of, an expert, if you will, on these HRO tools. So Kathy, next slide. So what did we see after leadership training? So we saw a nice bounce on a couple of things. One of the things we saw was more emphasis on that rounding to influence. So we saw a nice uptick from the executive training, but now we actually kind of saw that move down in that next layer. Lots of scripts have gotten created that folks can use for the different things that they want to round to influence on. And actually, some of our facilities do a nice job as part of their daily huddles or once a week, maybe just deciding, in our facility, these are the one or the two things that are really important to us. And so these are the one or two things that we really want you to round to influence on. The other thing that we really saw too is increased use of the unit learning boards. So with the learning boards, that was new to Sentara. As Kathy said, we started with the huddle board, the learning board at the facility huddle. Now we're really in that process of moving it down to unit or department levels. Kathy showed you a template. In fact, the picture on the right-hand side of the slide there goes according to our template. But what we've also said, hey, here's the sections that we want you to have on your reliability board. But certainly, if you have something that works better or works better for your particular unit or department, feel free. So on the left-hand side, you could example on an oncology unit, a brand new board that they've obviously have lots of passion about and very creative, so that they're using and are finding some success with. So those are two things that we really saw kind of take off after that leader training. So Kathy, next slide. So this is references we kind of pulled together for our leaders. This is on our WaveNet, our Sentara intranet. Each of the hyperlinks on the bottom of the page there. You can see the 3 roles of leaders, the message on mission, safe operations, build accountability, things Kathy went over. Each of the tools is actually a hyperlink. Underneath that hyperlink are some resources for our leaders. So under the safety message, there's a bunch of safety stories. Under rounding to influence, they'll find some of the scripts that have been created for rounding for COTI, for CLAPSI, for customer service, for whatever. Examples of learning boards. So just some videos under situation behavior impacts and videos on, how to deliver constructive and positive feedback using SBI. So good resources for our leaders, just some, some reference materials to help embed and keep them using our tools and getting better and better with those tools. So Kathy, next slide. So this is a multi-year journey for us. So 2 years into the journey now, and we're getting ready to move into our 3rd and 4th year. So one of the things we want to do is really do an assessment after we've trained our senior executives, we've trained our other leaders on the HRO principles, on the HRO tools, the reliability tools. So we're again working with HPI. HPI has a tool that's called RISI, R-I-S-I for its acronym assessment that stands for Reliability Implementation Sustainment Index. So in the 1st quarter, actually it'll be in February and March, HPI's 4 of their consultants are coming back into 4 of our hospitals and really spending a day and really looking at those tools, see how they're embedded, and then really teaching Kathy and I how to use that reliability implementation sustainment index so that, you know, hopefully it's a tool that we're going to find helpful and that it's something that we can embed locally so that we can keep track on how we're doing with those reliability tools. So next year, we're just starting on the work for 2018. We are working on reliability and safety training now. You know, Kathy said we intentionally started at the top with the executives, or we started with the executives, moved to the next level of leadership. And then our next part of the journey is really touching all of the 27,000 employees and medical staff with some kind of reliability and safety training. So we're just now working on, you know, what that's going to look like. But what we're really thinking is that it will include a video that hopefully really tells the staff the why message. An interactive CBT, so some of the didactic content they can get, and then some kind of let's bring you into a classroom and ask you to practice what we've just shown you so we can make sure that you really have good information and know how to use those error prevention tools and those team skills, those things that are probably going to be included in the reliability and safety training over the next couple of years. So Kathy, is that the last slide?
That is it.
So Joan, I think we've been through our slides.
Well, thank you, guys, and we will like to open up the chat box, and if anyone, participants listening to the webinar have any questions, please type those into the chat box that's on the tab menu. And we will monitor that chat box and bring the questions to the Sentara team. I don't have any questions coming in right yet, but let me ask a question. What was one of your biggest challenges to doing this? And what are one of your biggest rewards that you've seen so far?
So this is Sarah. I think the biggest challenges were really making sure that, you know, we have a big company, we have lots of employees, and really making sure that all of our information was very relevant, no matter to leaders, no matter what division. And we'll be doing the same thing as we move to the staff and physician training. It's just really making sure that that training and how we touch those folks is really relevant to them. So I think that that is our big challenge. And then I think that for our success is the way that the uptake on these tools just really re-energized folks. I think we're starting to see some signs that it's going to pay off for us, and some of the trends we've already starting to see with our customer service, some of our quality and safety goals.
Thank you, Sarah. We're still monitoring, and we don't have any questions coming in, so I don't know. Oh, please repeat the name of the author and the name of the book.
Sure. This is Kathy. The name of the book is Feedback That Works: How to Build and Deliver Your Message. And the author is Sloan, S-L-O-A-N, Weitzel, W-E-I-T-Z-E-L.
Thank you, Kathy. Any more questions from the participants or from the audience? Well, Dr. Lundy and Kathy and Sarah, any more comments you want to make? We're still looking for questions to come in.
No, this is Joel. I would just say that this is going to be an interesting year, and maybe we can circle back. You know, trying to figure out a way to get this information meaningfully to 27,000 members of the team and to physicians who are both employed and unemployed. Unemployed physicians, and that's going to be difficult, and we're working through that now. So more to follow. Okay.
This has been great information. I'm sure it's going to be something to digest and to look through and be profitable to many of our participants that are listening today. This information, as a reminder, will be posted on the VHHA website where all of our brown bag webinars have been archived. We will also send out the link to this recorded webinar to those of you that have registered. With that, if there are no more questions, we're going to give you back 5 minutes of your day. And Dr. Bundy and Sarah and Kathy, thank you so much for all you've presented, and we'll see everyone hopefully at the next session in February. Thank you so much.
Thank you. Have a great day. Bye-bye.